From our last meetup. Our last meetup we covered
Nice.
an airway. So it's part of our thing. You guys want to take a look at the board real quick? All right. Now we're
come
going to
on.
cover respirations.
Stop being
Okay.
a piece of crap.
So with respirations, you want to the first thing you want to do is remove. This is after you've made sure that they're breathing. You've established an airway. Started with put a nasopharyngeal airway in, or whatever it is that you're going to do to maintain the airway. Okay. All right. You're going to remove the body armor if the situation says that you can. If you're still underneath fire, you probably don't want to take that body armor off yet. Okay. So anything in the box, which is between here to here, anything in the box, you want to put an occlusive dressing, which is your hyphen chest seals. Your hyphen chest seals, or whatever it is that you're going to be using to cover a hole. All right.
Jerry, I got a question there.
I got answers.
So, the patient is not exhibiting any difficulty breathing. You put it on anyway?
If you have a hole in the box,
Yep.
you put it on.
Okay.
Okay? Even if they don't have any trouble breathing yet, if you got a hole in the box, you put it on. That's front and back. Okay? And when you have your patient, they're lying on the ground, underneath. You want to take your gloves. You want to make sure you got purple gloves. You don't want to use black ones because it's really hard to see blood on black, especially in the dark. But the purple gloves, it really stands out a lot. So you want to sweep underneath the box, and you want to make sure if you got a hole in the front, you probably got a hole in the back. And if they're unconscious and they're not saying that they are hurting, you got to do a sweep. So you want to sweep underneath and check to see if there's any blood or anything coming out of the box there. If there's anything coming out of the box, you can roll your patient to expose the area, and then you add a chest seal. Bearfacts come with 2 hyphen chest seals in them. That's what they're there for. Okay. So you want to expose the neck, okay, and you're going to check for any deviations or injuries, okay. Bruising, you're going to be looking for squall. Some people don't spend all that money for the extra coating on the plate, and you'll get that spall, and it'll cut your throat up real good, and you won't even see it until you start to expose it. All right. You're going to check for breathing, rise and fall. So I should have brought my mannequin out. Concrete Hades, please come up. I need your assistance. Okay. Stand over here, please. Face everybody. Okay. So like if he was lying on the ground, I want to approach him from the side, and I want to put my hands on his chest like a butterfly, like this. And I want to give it a few seconds to make sure I'm checking for rise and fall of the chest. I'm also going to be looking for seesaw breathing. If his chest and stomach is doing this, that's not a good thing. That means he has problems breathing up here. Okay? He could have broken ribs, he could have blood in the lungs, or even declaps lung. Okay? So you're watching for seesaw breathing, and you're making sure that it's got equal rise. While you're doing this, you're going to do a little squeeze on it. You want to check for pain. Pain response or broken ribs. You're going to feel like Rice Krispies underneath the skin. Okay? While we're here, we're going to expose the chest, and we're going to check the sternum, make sure everything is in place where it belongs. Then at this point, we're going to assess for breathing. Okay? So in order to assess for breathing, you need to find the breathing rate. Breathing rates, between 14 and 20 is normal. So you're going to look for, what you're going to do is you're going to observe for 15 seconds the rise and fall of the chest. So you're going to need to watch, you're going to need to count 15 seconds and watch the rise and fall. You take that number and multiply it by 4. Okay? And then you're going to record the rate. So you should have a notepad in your first aid kit. A little notepad. You can even write little reminders of what normal is, or what to assess, or what your TCCC card has on it. This is the TCCC card. You can sit down if you want. This is TCCC card. I'll pass it around if you want. It's got something to hold on to the patient with, but you can write all the assessments that you need to write down on here. Go ahead.
You had mentioned that there was a difference in how they're breathing. May indicate that there's a punctured lung.
Right.
Something going on with the lung.
Yep.
Are you considering a decompression needle at that point?
You're going to consider a decompression needle if you have signs to look for. You have to know that one lung is good versus the other. So when you get to that point for the needle decompression, you're going to feel like it's a drum on one side. It's going to be really, really hard on the one side. It's not going to move. Okay, and the later sign is when you see the throat, the Adam's apple will start to deviate from the center. So if it's filled up like on this side, the throat's going to start to move away from that area. Okay, and that's where you're going to be like, okay, I can do a needle decompression, which is the #1 field preventable thing you can do to save somebody's life is a needle decompression. And you know, you can get a collapsed lung from coughing too hard. You can get a collapsed lung from getting hit by a round in body armor too.
Car accident.
Car accident, right there.
Gary, where would you get the TCCC cards from? I know that they don't come in
They're
Fairfax or.
I got them $8. Here, this is one I ordered. That one came with the practice kit.
Right.
This I ordered for $8 on Amazon, and it's from North American Rescue. And it comes with 8 of them in here, and a marker. And this is going to go in the squad pack here, which I think I have here. Yep. Yeah, this is going to be for this is the household pack, household, response kit that we're setting up here. It's going to have the stretcher in here, and TCCC cards and other assessment tools. But yeah, it's the same thing. It's got the cards on the stuff on both sides, and it's got a marker. You guys get one? Pass this one around. And just put one in your first aid kit, because the Bear Pack does not come with one. So either get one of those, or a cheaper solution would be, which is, I don't know what you can do for $8, really, for TCCC cards. But you can write your assessments on a little notepad here, and then laminate it so that you have a notepad or something with you so you can write down your assessments.
Well, I think.
But respirations is your first assessment that you're going to put on there.
I think what I'm going to do, and I don't know what I'm going to order some of those, and on the card I'm going to put what the normals are, because in that kind of stressful situation, I'm going to forget.
Sure. Or you could even take your notepad. This is what you're looking for, and this is the normals. And then you can just put a little bit of contact paper. This I picked up from the Dollar Tree. Just little contact paper. I picked this up from the Dollar Tree. Boom, done. You have a TCCC card, and lots of paper to write stuff on. And that's your first assessment. If you want to practice trying to do respirations, everybody got to watch? Okay. You want to practice it?
Sure.
Okay. So what you're going to do is you're going to practice on me, okay? And I'm going to tie myself. I lost my phone. There it is. Okay. get it? What'd you get? 6 or 7? What'd you get? Anybody else?
6.
You got 6? Okay. What's 6 times 4?
24.
Very good. That's what I got. Alright. So you know what you're looking for? You're looking for the chest moving, you're looking for the body rising and falling. Alright. So we're going to move on to circulation. That's going to start your next assessments. You're going to check your interventions at this point. You're going to check your tourniquet. You're going to check your pressure dressings. You're going to check your extremities. If you have a tourniquet on that extremity, you want to check to see if there's a pulse down there. Because then you need to know, that way you know the tourniquet is working. Okay? If you still have bleeding and your tourniquet is, and you still have a pulse, you can add another tourniquet. Do not loosen that tourniquet. You add a second tourniquet to that area. So if you're using your buddy's IFAC, right, and you got his, you're using his tourniquet, grab yours out, throw it on him, and add another tourniquet right next to his, high and tight. Okay?
Above or below, does it matter?
Best is above if you can get up there. Okay? If he put it down here, throw it up high. Okay? And go ahead.
If you're in a field situation and you need to apply a tourniquet and you're not going to get evac'd and there's nobody else, when, if at all, do you remove the tourniquet? Or is that a stupid question because it's going to bleed
No,
out?
it's actually, that's actually down here at the bottom.
Oh,
That's called a tourniquet conversion, and I'm going to hit that.
okay.
Okay?
Cool.
But that's also a good point. If the police are not coming,
Right, you're on your own.
the ambulance is not coming. So you should know where the hospitals are, and I know over here, up going north, there's a level 2 hospital. I know going south, past Bethlehem, you gotta go past the other hospital going towards Allentown, you got a level 1 hospital. You wanna go to that level 1 hospital because you got a gunshot wound. Okay, because they got specialists on standby to fix that. Okay? And, you know, I used to work with FEMA a lot, and the number one thing was to secure infrastructure. Secure the hospital, secure the police stations, make sure that they have generators and fuel and things up and running. So if things are not working around us and one of your buddies gets shot, you might need to convert your vehicle into an ambulance and take them out of here. Okay? Moving on to circulation. So here's where you're going to blood sweep your extremities here. You're going to go down here, you're going to check the groin area, you're going to check the abdomen, you're going to sweep on down the legs. You're going to make sure that you're going to check all your, check around, you're going to look for a decap ETLS, which is, I had to spell that last week. It was deformities, contusions, abrasions, punctures, you know, bruises, I think it was, burns. And you're looking for, you know, just basic deformities, and you want to note them down on your card. Okay? So here's the next assessment you're going to do. You're going to record. You're going to record skin color, temperature, pulse, and capillary refill. What capillary refill tells you is that they have a blood pressure greater than 80, and that's a good thing. If they have a capillary refill that's delayed more than 1 to 2 seconds, you're looking at internal bleeding, or you're looking at a lot of blood loss if you have a humongous trauma. Which means you should check your interventions. Let's say you put a tourniquet down here. The upper thigh will fill up with a lot of blood. So you might want to consider, if they put the tourniquet down here and they stop the bleeding down there, that doesn't mean that there isn't internal bleeding going up here. Okay? You'll bleed out internally just into your leg alone. It'll hold a lot of blood in between the muscle fibers.
Where at are you looking for the capillary refill?
Huh?
Where are you looking for the capillary refill?
Extensions in your finger. Okay, so in order to assess capillary refill, you're going to take, like the thumb, You squeeze it, take it, and it's going to go pink right away. If it takes a longer time, then the blood pressure is low. Okay? And pink, warm, and dry is your goal assessment for skin condition. Okay? Any deviations from that definitely need to be noted. Okay? To assess pulse. Has anybody taken a pulse before? Okay. Few? Alright. In order to assess pulse, you're going to take your watch, again, you're going to go for right here next to the thumb, you feel on yourself, there's a bulge, it'll start bulging. Press down until you feel the bulge. You want to halfway, you kind of want to halfway occlude that radial artery. And you'll feel the bump. And you're going to assess that for 15 seconds times 4. Okay? Normal pulse is 80 to 100.
Where else can you check for a pulse?
You can check for a pulse in carotid, coming down here by the ear, either side. Or you can check for pulse on top of the foot, right at the top of the bridge of the foot. You can check there for a pulse, or on the side of the ankle on the inside. You can check for pulse. Okay? Those are the areas you want to check. Down here, 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 or here. And especially if you got a tourniquet, you want to check for the distal pulse on that tourniquet. And then you want to write it down. All right. At this point, you want to get your stretcher ready. Okay? You want to be able to get your stretcher ready. So you're going to prep your stretcher like this one, or you're going to use a tarp or whatever it is that you're going to use to help move your buddy, because you don't want to just drag your buddy around, right? Or your family member or your children, right? So you want to prep your stretcher, stretch it out, and prepare it for when you're going to roll your patient. You're going to roll your patient towards you or in an area that's not broken. So if you have a injury on their right arm, you want to roll them away from that, you know? So you're going to roll your patient. At this point, you're going to check to make sure there isn't any injuries that you missed at this point. No, nothing in the box, nothing in the back end. You're going to double check and check your assessments. Okay? And then you're going to put the stretcher underneath them and get them onto the stretcher. This is all happens in 10 minutes. You can get this done with practice. So we get them on the stretcher. You're going to check for holes and deformities. You can check their spine. You want to make sure that their spine's good. So if their spine's not good, you might want to consider waiting for the ambulance if they're in a situation that there is an ambulance. Okay? Otherwise, you can improvise a hardboard with your stretcher and throw some plywood underneath there or something. You know, if you have time to wait, because you don't want to further injure them. All right, after you roll them, you're going to check them for LOC. LOC is their level of consciousness. There's 3 assessments you want to check for: time, place, and person. If they know who they are, where they are, and what they do, that's a person thing, you know. If they are aware of the time of day or the years and stuff like that, that's their time. And place is if they're aware of where they have been, you know, or where they are. Those are your 3 assessments, and that would be AOC times 3. Alert, oriented, times 3 is what the medical abbreviation is for that. All right, and then for your hypothermia, head injuries, and hypovolemia. Okay, so from this point, you now have your patient on your stretcher. You've patched up all your holes. Now you're going to be starting to look for your we're going to start for treating for hypothermia. So you want to grab your Mylar blanket, you want to spread it out. While you're doing this, you're going to be checking for any other minor injuries that might be patched up or covered up that you need to clean and take care of their wounds. If they have a lot of blood loss, you want to take their gear and put it underneath their feet to elevate their, a lot of people, if anybody goes on a squad mission or they're doing something, you can take their backpack, put it underneath their feet to elevate their legs. So while you're moving them, you're getting that extra blood to the organs, right? And then check for head injuries. If they have a head injury and you're not having major blood loss, you can do the opposite and raise their head up, because that'll help with preventing swelling to the brain, and that'll help with them being able to recover, getting to the hospital in an appropriate amount of time. I understand this is a lot of dealing with hospitals, and a lot of what we talked about is not dealing with infrastructure, but realistically, everybody should know where the closest hospital is, where you are.
Are there concerns or something that you would recommend while that person's in transit for monitoring or something along those lines?
Well, like, my van can I can lay down one side of the backside, and I can put a person in there, and I can have somebody monitoring the person. If you're gonna go in past March, okay, so let me finish up this, and then we'll talk about doing that part first. All right. So once we do that, we checked everything else, we're gonna go for your tourniquet conversion. Let's say if you really think that this person's injury is not that bad, okay? For example, grandma nicked her varicose veins and there's blood everywhere, and you threw a tourniquet on because you panicked, and you put a pressure dressing on, and the bleeding's now kind of stopped. You can, within 2 hours of applying that tourniquet, you can convert it, doing a quarter turn every minute to take it off without causing an injury within 2 hours. Okay, and then as you're unturning it, you're checking to see if it starts bleeding again. Okay?
So, question, with the tourniquet, my understanding is it's only half turns. How would you do a quarter turn on a tourniquet?
You're gonna hold on to it.
Okay.
You wanna do a quarter? This is the book. What they do actually in the field, they'll just let it go. That's the other way of doing it. They'll just let it go if they feel confident with it not being as bad as it was.
We did ours last week on when to apply a tourniquet and when not to.
Right.
If it's spurting out of your leg, you gotta put a tourniquet on.
Right.
If the blood is oozing down his leg and he's bleeding out, you gotta put a tourniquet on. If it's just a wound, compression.
Right.
So that was one of the things we went over too, because everybody thinks, okay, I gotta put a tourniquet on. So those idiots shot themselves with a rubber bullet and they put a tourniquet on.
Well, that's true, but pressure dressings like these, in combination with tourniquet will get the bleeding under control
Right.
within 10 minutes. Without, in addition to quick clot. Yep. I just bought another one. In addition with quick clot, okay, this will stop it in 3 minutes.
We're making it mandatory that everybody's got their own IFAC on there.
Right.
Everybody.
But if you have an issue with someone on Coumadin, for example, or another blood thinner, or they are anemic or things like that, you may want to consider Celox. But for some people, this will stop bleeding within 1 minute.
Okay?
But it starts to get warm, it heats up. Some people don't like that. On top of that, for some people, for religious reasons, this is unclean. This is made with shellfish. Okay? All right, and that's it on that for today. I was thinking that maybe another time I can get with you and we can talk about doing an antibiotic class come the white time.
Yep.
Okay?
Yep, sounds good.
We had, you brought the antibiotic therapy handouts last time.
Right.
I get free printing. I can print out 100
Well,
more
like the fish
copies.
store in town, they sell fish antibiotics. And if you didn't know, fish antibiotics are the same thing that people take. It's the same dose.
That's amoxicillin.
Yeah, but the fish store sells all of them.
You got to check the right one because last time I was
Thomas Labs is the one you want to check for. Make sure
Okay.
that it's Thomas Labs.
Is that the brand or?
It's manufacturer.
Yeah, okay.
But yeah, that's pretty much where we're at. I mean, if they have combat meds, give them combat meds, especially if they got hit. You know, Tylenol, high dose Tylenol,
Yeah,
amoxicillin is great, or you know whatever's. Gosh, I can't remember the name right now. It was in my notes, but the combat med pack is got the pain relievers. And it's got the antibiotics. And look into it. You can still get them on the internet, but they're a little pricey. You can.
Everybody should have their blood type on their vests. So if one person goes down and another person's O positive, go with them to the hospital and give it. Because right now with the COVID shit, the blood banks are empty.
Are they?
You got somebody in your group that's the same blood type, it's always good to have. And no, they do it in the Marines, they do it in the Army. Everybody knows their blood type. It's on their vest, or it's even some of these guys got it tattooed on their arms. So it's just a good point. We're doing it.
Nope.
We're not getting tattoos, but we're putting it on us.
Okay.
Question, Jerry.
So, Jerry, quickly for people to find out what their blood type is.
Amazon. As a kid. On Amazon. If you never gave, I never gave blood, I passed out. Sorry.
Okay. Now, a couple other things you can get to help with assessments is a pulse ox. If you're going to get a pulse ox, I recommend one that takes a AAA or a AA battery. That way you can recharge them. The ones with the little button batteries really don't last long, and they do not work. And, you know, they got the little plug-ins, and they recharge, and they don't last that long. Believe me, I know.
Pulse
I
ox is cheap.
Yeah, because they're cheap.
All things are considered very cheap.
Right, right. The other assessment that you could do that I could teach you is how to take a blood pressure. Anybody want to learn how to take a blood pressure? Come on up and I will show you.
I'll split it with you, Jerry. Let me go get
Thanks.
my stuff.
Well, yeah. Have a seat. Okay, so if we can expose an arm, that would be great. Okay. So, what we're gonna do is we're aiming for right here, right here. If you turn your thumb up. Okay, great. Okay, so see what happened just there? See that little dip right here? This is where we're aiming for right here. Okay, this is the vein and this is the artery. So what we do, put the blood pressure cuff on. Okay, you want to put it as tight as possible. You want to put the dial in a place that you want to see. So we're going to put it right here where you can see. Nope. Yeah, you can hold that. All right. So when you put on stethoscope, okay, you're gonna have the little ends are gonna point away from you, so they go on like this. Okay.
That seems counterintuitive.
What? Because your ears go that way.
I'm just saying it seems, but then again, my brain doesn't work real well.
Well, I mean, this is a cheap one from Amazon, but this is not.
It's a Littman.
This is a Littman, but they're guaranteed for life. Okay. So what's going to happen is that when I'm gonna use mine, and you can use this one, and we're going to squeeze this until okay, you feel the Here, let me just hold this in a different spot. Here, I'll hold it for you. And I'll do the pumping. What you want to do is you want to put this down there. Yep. And I'm going to listen right here. All right. So, we're going to squeeze this until we start to hear that pulse.
Anybody else want to know everything? You want to try that? Sure.
Right there.
Just show somebody.
And then we're going to go 30 away.
Good. Try to do this.
You hear it?
Oh, boy.
It came back on. Do you hear the pulse yet?
Do this right.
And that's where it starts to fade away, right there.
So it's from the time you start to hear it to the time it starts to fade away.
Yeah.
It's not directly over there. Because sometimes it'll pick up your pulse in the thumb.
Hear it? 138.
Typically, if you're not dealing with somebody with no blood pressure, issues, pop up to about 160.
82.
Okay. All right.
All right.
That makes sense. Cool.
All right. Who is next? Here, I'll take that. Let me clean it off.